Hello friends. Today, my dear friends, we shall talk about sinusitis or sinus problems. Myself, Professor Dr. Dhakeshwar Singh Potsangbam. I am the professor and head of ENT in Jennings, Imphal, Manipur, and it is in India. And what is sinus? Many of my patients come to me and tell the doctor, I'm having sinus. What they really meant was that they are having some sinus problems. Anyway, so sinus in Latin means it's a cavity inside the skull. The cavity means sinus. So inside the skull, there are some cavities. Here you can see the frontal sinus, then on the right and left, and here these are the ethmoidal sinuses, and deep inside you will get the sphenoid sinus, and on both sides of the cheek you have this maxillary sinus. So these are the cavities. Then if there is any infection in these cavity in the sinuses, if there is any infection in the cavities, then we call it as sinusitis. Okay. So most people take hypertrophy of the nasal turbinates as sinus ailment. So what do we see is that like this. A patient come to me and telling the doctor, I'm having sinus. Sinus is enlarged. So what they mean to say is that the turbinate inside the nose, these are inferior turbinates that you can see, the swellings, the flacy swellings inside the nose. These are nothing but the inferior turbinates. And these turbinates are swellings, flacy swellings on the outside wall of the nasal cavity, inside the nasal cavity. So these turbinates, they are acting like air conditioners. They warm the air which is inhaled. At the same time, it gives the humidity to the air which is inhaled, so that it will not cause any problem to the lungs and alveoli. So the hypertrophy of the turbinates are mainly seen in allergy. So during allergic problems, when the nasal terminals are enlarged and the nose blocks are there, patients are very much conscious, and they are thinking that this is a sinus, a swollen sinus, and causing problem. And you can see this is from the throat. This is called a trachea, and the voice box is called a larynx from here from the mouth and the nose. When the breath comes in, it goes inside both sides of the lungs, and inside the lungs you'll find something like this. These are the alveoli. This is the area where the exchange of gases takes place. So oxygen is taken inside the body and the carbon dioxide is given out. So these are very delicate structures, and these are being seen as a very microscopic structures, and we are showing it under magnification. So this is the lungs, and these are small are the alveoli, and this is what you're seeing here and under magnification. So when there is some lack of moisture in the air which we are breathing, say for example in the winter, and also if the air is too cold or too hot, it will cause some injury inside the alveoli. So just to remove the infection or remove this injury, the air which is being inhaled, they are being given moisture and warmth, or say some air conditioning is being done before it is inhaled inside the lungs. So this is the function of the turbinates. So what are the mucous membranes of the nose and sinuses? What you can see in the anatomy, this is an enlarged version of the skin, the moist skin inside the nose and the sinuses. The walls of the sinuses and the wall of the nose, they are lined by this mucous membrane. Okay, and this mucous membrane, they are very moist and they produce mucus secretion, and this mucus secretions from the frontal sinus, it comes down like this. It is the green one is the frontal sinus, then the red ones are the ethmoidal sinuses, okay, then this blue one is the maxillary sinus, it is shown here, and this pink one is the sphenoid sinus, and these are the maxillary sinuses, then sphenoid sinus, frontal sinus, and the others are the ethmoidal sinuses. And all these secretions, they come into the nose cavity, and from there it goes down into the throat, and it is swallowed into the esophagus, then into the stomach. So these secretions, what are their functions is that they keep the nose moist, the skin lining of the nose moist, and also the sinuses moist. At the same time, they also remove the dirt from inside the nose, which is being inhaled through the nose. At the same time, if there is any germs, bacteria, virus, or fungus, whatever, they are being expelled into the stomach, so that they can be killed by the stomach acid. So this is the function which is usually the first line of defense in the body. Now, when there is inflammation, especially in the acute sinusitis, what will happen? There is increase in the swelling of the sinuses, sinus mucous membrane. At the same time, the ciliary action, the cilia, actually there are some this hair-like structures which are attached to the mucous membrane. They beat and they expel out the mucus secretion. So they help in the removing the mucus secretion, and all these hair-like structures which are microscopic, and their function is being lost during the acute infection of the sinuses. And it leads to blockage of the sinuses by stagnation of the mucus inside the sinuses, and this leads to the germs getting settled here and getting infected and causing pus collections. So this is how the sinusitis can occur. Now, allergy. Many of us have got a misconception that allergy is sinusitis. No, allergy can be a cause of sinusitis. Allergy is nothing but a sort of reaction that is caused by the inhaled particles. When they come in contact with the nose mucosa, they produce some reactions. This is allergic reactions, which causes red and itchy watery eyes, and sneezing, congestion of the nose, then runny nose, then itchy or sore throat, postnasal drip, that is some drip inside the throat coming from behind the nose, then coughing, then the itchy ears sometimes, and some buzzing sound can also occur during time of allergy. And you see, when the allergic reaction takes place, what happens is that this mucous membrane becomes much thickened. They becomes much thickened, so nose becomes blocked, and sometimes this blockage spreads to the sinuses, and there is stasis or stagnancy of the fluid which is supposed to come out through the nose. They are blocked, and inflammation starts because of that, because of the allergic reaction. At the same time, because of the blockage of the sinuses, this will lead to sinusitis. So blockage of the sinus opening leads to sinusitis. So this is the main reason why we have sinusitis. Now you can see these are the sinuses, and sometimes this is the septum. Septum means the wall, bony wall in between the two nasal cavities. This divides the two nasal cavities into two halves. And when there is deviation of this, that's why some doctors used to tell you when you go to the ENT doctor, they will say that your septum is curved to one side, deviated to one side. So this is the deviation. This deviation sometimes may block the opening of the sinuses, and this can lead to stagnancy or stasis of the secretion inside the sinus, which leads to the infection. Sometimes polyps or some changes in the mucosa because of allergy or infection. It can lead to some swelling of the sinuses, mucosa, and this will lead to blockage of the sinuses and leading to sinusitis. Now the same thing is being shown on this side also. This is the normal side, this is the healthy side of the sinuses, and this is the unhealthy side of the sinuses. You can see there is inflamed sinuses with secretion here, and secretions, there is stagnancy and collection of this secretion, and there are even pus collections inside the nose. So all these are findings that we see in case of sinusitis. So what are the symptoms, that how will you know that you are having a sinus problem? Usually you will have fever, some headache, then rhinitis, that is nose running, then chills, you will feel chilly because of the fever, then sometimes you will have cough, then some pressure in the face, the pressure sensation in the face where the sinuses are located. Okay, so these are the signs and symptoms from which you know that there is some sinus problems. Now, treatment. The treatment is to be done by doctors, but there are some which you can do at home. Then my suggestion here will be when to do the treatment and how to approach and whom to approach. That is my idea of giving this slide. Okay, so the sinusitis, the symptoms are green or yellow mucus from the nose. Sometimes it is foul smelling also. Then there will be sore throat, and toothache also can happen at times. Then nasal congestion, then pressure or pain on the face. So treatment. At home what you can do is you can put some saline nasal drops in the nose. Then you can get yourself removed from chemicals and cigarette smoke and some smoke and environmental pollution you have to avoid. Then warm compresses can be done on the face. Then as for allergy, if you want to remove allergy for lifetime, you have to do immunotherapy, or you have to keep on taking anti-allergic medications. So anti-allergic medications can be taken from the pharmacy and they are sold over the counter. But antibiotics, especially if you are having fever, and in the beginning 1 or 2 days you can take some paracetamol to remove the fever, but don't take any antibiotics by yourself. This is called self-medication, which is not recommended. So what you have to do is you can approach any physician and they can give you some antibiotics which can get yourself relieved. But if it comes regularly, off and on, and if it is becoming a big problem, then you have to go to an ENT surgeon who may do some surgery like functional endoscopic sinus surgery or septoplasty. When the septum is too much deviated, some septoplasty may be done. Then immunotherapy can also be done nowadays in Imphal. Then you can come and you can have an immunotherapy done so that you will get yourself relieved from the allergic problems. So these are the few guidelines that I want to give you regarding the sinusitis, and this is the end. We want to make it as short as possible so that it won't be a bother to you, and when you won't be wasting too much of your time learning something about the sinusitis. And this comes to an end for us, and we'd like to request you to go through the video and find out what are the signs and symptoms of the sinusitis and how you can approach a physician for primary treatment, then ENT surgeon if it becomes too much of a problem to you. So once again, thank you very much for watching my video, and I hope you can enjoy it. And if you find anything which is not clear to you, kindly write to me, send messages, and I can reply to you promptly. Thank you very much for watching.